Hi everyone, my name is Gary. I'm a respiratory therapist, also known as a respiratory care practitioner, and I live in Los Angeles, California. And this video is kind of just about why did I choose respiratory? Is respiratory right for you? Or which career is right for you? Because I feel like a lot of people always ask me, should I go into nursing? Should I go into respiratory? Or they were initially planning on nursing, but then the program was really, crowded and they have to wait to get in, and then now they're considering respiratory. And some people initially want to go into nursing and then they kind of fall in love with the idea of respiratory. But of course, they don't know much about it because there's not a lot of stuff about respiratory out there. So it's kind of hard to truly decide on respiratory when not a lot of people know what it is about. And that totally makes sense because, respiratory it's one of those careers where it's so specialized that you don't really know what an RT is until you've experienced something where you need an RT, and you don't want to need an RT because that either means that you have a family member or you were critically injured, you were maybe on a ventilator, or someone that was on a ventilator, someone that was intubated before, you're having an asthma attack, you can't breathe. I mean, you kind of don't want to see a respiratory therapist because we specialize in the cardiopulmonary system, in the lungs, and when you're having a problem with the lungs, it's no bueno. But why did I get into respiratory? How did I know? Honestly, I didn't know. The only other career that was at my college was nursing, of course, and I was reading the description, I was reading the duties, I was reading the classes that were required, and it just did not interest me. There was a couple things where I was like, oh, maybe, but then the rest I was like, I don't know, and then I started watching nursing videos, and I don't know, what I love about nursing is that there's so many options that you can do. You can go so much further with nursing. So if bedside nursing doesn't appeal to you, there's so much more you can do. You can, work in an office, you can do outpatient stuff, you can do help with Botox and all of that type of stuff. But with respiratory, you're kind of limited to just the hospital, or you can do home care, you can do PFTs, you can teach, but mainly our main job and source of income is working in a hospital. So yeah, with nursing, there's more avenues you can do, which is amazing. But yeah, so respiratory, I was just kind of looking at other medical careers because nursing wasn't interesting me. And I came across respiratory and I was like, wait, my grandma's an RT. Why did I not think of this sooner? I really did not think of it. I did not ask her about it. I just stumbled upon it on my Google research of other healthcare careers. And I started reading about it and I was like, wait, this sounds really interesting. And if you're having that thought, I don't really know much about it, but it's interesting to me, then go for it, pursue it, because it's piquing your interest, and that is a number one reason to pursue something. For example, nursing wasn't piquing my interest. If I picked nursing, I would probably go through a lot of months of reconsidering and wishing I did it or didn't, and going back and forth if this was right for me. So if it's piquing your interest, then definitely I would say follow through with that interest, do some more research if you can, or just go for it. And thankfully with my college program there was 2 classes that you could take before you got into the program. So it really introduced what being an RT was and what you do as an RT. So that was really nice, but I know a lot of other colleges don't have that option. Thankfully nowadays, even years after I initially started my journey, there's so much more stuff on the internet now. It's still limited, but when I first started looking in I don't know what year it even was, around 2016, there was nothing out there. But yeah, so I wanted a job that was in healthcare. I knew I didn't want to do nursing. I came across respiratory. I fell in love with the idea. And what I really liked about respiratory is it's in such demand, and it's projected to be in demand for many years. And that's what I really liked about it. It's a short schooling process. All you need is your associates as of now, which is just a 2-year program. So you have to take your preclinical classes before that and your general ed to get your associate's degree, and that takes some time. But besides that, the program is just 2 years, whereas nursing, it could be 4 years, and to be a doctor, it's so much more, and PA, so much more, right? So the 2 years, the short time frame, that really intrigued me also. And what else? I love that we're all over the hospital. I always compare it to nursing because it's the closest position. Not that I'm picking on nursing at all. I love my nurses. A lot of my friends are nurses, but just because there's a lot of similarities, and we work really close together. So for example, with nursing, most of the time, depending what unit you're in, you have about 2 to 4 patients. And, if you're lucky with safe staffing ratios. And with respiratory, we have anywhere from 7 to 20 patients, and you could be on multiple floors in one shift. And although it sounds like a lot, you're not constantly caring for these patients for your 12-hour shift. You're kind of going there every now and then, or only sometimes once a shift, to see these patients. And so don't worry, you don't have 20 patients for the full 12 hours. But what I really like about that is I get to interact with so many different patients, and I get to do different modalities with these patients and give different treatments with these patients. And, we are part of Code Blues, we're part of intubations, we're part of rapid response teams, we work in the NICU, we work with the pediatrics, we work with adults, we are on the floors, we are managing the ventilators, we're helping intubate, we are extubating patients. There's just so much that we do, and I really love that. I'm constantly running around, not doing the same thing. Every day is different. And it just keeps things fresh and exciting. And that's why I chose respiratory. And if any of that intrigues you, then maybe follow with respiratory as well. You can follow along my journey on Instagram. It's at Garry, GarryRT, at Instagram. It's on Instagram, at GarryRT on Instagram. And then you could also look at some of my old YouTube videos here. Some of them are a little cringe because they're so old, but I know that they're really helpful to other people, so I leave them up. But yeah, it's, you can do it. And I always tell everybody, don't treat it like some big scary medical program. Just treat it like any other class. You're going to go to class, you're going to read, you're going to study, you're going to prepare, you're going to take notes, you're going to make friends, you're going to have fun, you're going to rotate at different hospitals, you're going to learn a lot. And obviously it's scary at first because you don't know, if you've never been in the medical field at all, you don't know what it's like to work in a hospital, and it is a responsibility. But at the end of the day, after you've graduated and you get your experience, you're like, wait, it wasn't that bad. And next thing you know, everything is second nature. All these medical terms and the terminology and the diseases and the disease processes and the medications and the treatments, it all comes second nature. And I promise it does get a lot easier, and it does get a lot better. And it's worth it. I like respiratory. I work 3 days a week. If I wanted to, I could work 1 day a week. I feel like I get paid nicely. And yeah, I don't have these crazy student loans. I highly recommend going the community college route. But yeah, that's why I chose respiratory, and hopefully this helps you choose any medical career that you're interested in. Okay, bye guys.